representative of organized labor, and I am a woman. I am so pleased today to say that some of my very first health care that I had as a young woman was in the clinic of a Planned Parenthood. I had my first pap smear there. And so I can understand why we're here today. I just returned from the convention of the National AFL-CIO where we adopted some pretty important initiatives. But you couldn't help but notice that the convention looked nothing like our Fathers Union of yesteryear. I was so proud to be among the 46% of delegates who were people of color and women. Making the convention one of the most diverse in recent times. And we talked about opening up and broadening the labor movement, recognizing that we must expand and be more inclusive, and recognize that all working families, whether you're in a union or not, are under direct assault. Right. Now, of course, as a labor movement, we talked a lot about the economy. An economy that creates a living wage for everyone seeking to have a job. An economy where everyone has health care. An economy where everyone has a job and supports a family. And an economy that provides for high quality education for all our children. Isn't that the kind of Ohio women want to live in? This is what we want our governor and our legislature to be concerned about. As women, we are half the workforce and 2/3 of the caregivers in our family. Yet, despite the fact that after more than a century of struggle and tremendous gains, we still don't have equality, and our health and our bodies is still a political agenda item. Now, as workers, along with men, women continue to fight for good jobs, a just economy, and family values at work. And now we must fight to make sure we stay in control of our bodies. Because when women are undervalued in work, still only making 77 cents for every dollar paid to a man, it's not only a problem for unions, it's a problem for all of us. When women's health come under attack by this Republican governor's budget that was passed at the 11th hour with no public hearings, no public input, it's a problem for all of us. The implications on K-6's budget on women is devastating. You heard it. Defunding Planned Parenthood, putting quality, affordable care for women at risk. Criminalizing doctors for administering care to their patients because a heartbeat test has not been administered, and imposing gag rules on counselors who are there to help women traumatized by rape. That's unthinkable. We are here today to send a message to Governor Kasich. You picked the wrong one